Hi, back with another session here. This is our third session of ward round. So let's start. Residents present the case. This is a 28-year-old G2P1 patient who was admitted 3 days ago with complaints of high-grade fever with lower abdominal pain and foul-smelling vaginal discharge for the last 5 days. She had a vaginal delivery 3 weeks ago at a local clinic which was conducted at home by the untrained birth attendant, and there was no documentation of aseptic precautions, and the placenta was delivered manually. Her postpartum period was uneventful initially, but she started having fever and abdominal pain around 2 weeks after delivery. She also complains of generalized weakness and decreased appetite. On examination, her vitals are like pulse rate was 104 beats per minute, BP was 100 by 60 mmHg, temperature 101.8 degree Fahrenheit, respiratory rate 22 per minute. On general examination, pallor was present, no icterus, no pedalodema. On abdominal examination, uterus is just above the symphysis pubis, tender and soft, no guarding or rigidity. Per speculum examination, foul-smelling purulent discharge seen. Cervix looks congested and inflamed. On per vaginal examination, uterus is 10 to 12 week in size, tender with bogey consistency. Fondnesses are free but mild tenderness is present. On investigations, her HB was 8.2 gram per dl, WBC count was 16,000, CRP elevated. USG pelvis was showing enlarged uterus, heterogeneous endometrial echo with fluid collection suggestive of the RPOC, no adnexal mass or free fluid seen. So now it's your turn to start asking question. You will ask, was the delivery preterm, term, postterm, because it was not mentioned anywhere in the history. So you have to ask this. Was the placenta delivered completely, and was there any excessive bleeding postpartum? Is the patient breastfeeding, and how has her lactation been? Has she had any chills, rigors or urinary symptoms with the fever? Was any antibiotic coverage given during or after delivery? What is the patient's blood group and RH status? Are there any sign of sepsis, altered sensorium, decreased urine output, hypotension? What were the findings on the abdominal ultrasound beside RPOC? Any signs of pelvic abscess or free fluid? Okay, so now we'll start with the questions of examiner. What is your provisional diagnosis and why?